Welcome. Today we have Chad Smith, who is a certified registered nurse anesthetist, to talk to us about what that means and what job it is. Welcome, Chad.
Thank you very much for having me.
So tell me what that job is and what it means to work in a facility.
So, as a certified registered nurse anesthetist, I began a career as a nurse, and then I pursued a higher education to specialize in anesthesia. I work every day in an operating room. Um, there's a lot of nurse anesthetists out there, but a lot of people strangely aren't as familiar with that. They're more familiar with the term anesthesiologist, which is the medical doctor version of the nurse anesthetist. But I work in an operating room every day. I have a few other responsibilities to keep a surgery center running, but for the most part, it's patient care.
And you described the doctor side of things. What is the difference between the two? Can you ultimately do the same job?
I can, and I actually get this question a lot from patients. Um, Medical doctors, they get a degree in something, a 4-year bachelor's degree. After that, they attend medical school, which is another 4 years. And then they might have a residency after that and a possible fellowship, which is further and further along in their education, specializing a little bit more each and every step of the way. As a nurse anesthetist, when I went to school, it was a master's degree. It's now almost every program is a doctorate degree. I've been doing it 15 years, and I think the doctorate program, every program is going to be doctorate by the year 2024. So this would affect your students right now. But I was a nurse. I had a bachelor's degree in nursing, and then I practiced nursing for about 9 years before I went back to school for the master's degree. And once I completed that, which was about 30 months in total time, began practicing.
So, what was it from nursing that made you switch from just doing a master's of nursing where you could do more administrative or more teaching to do the anesthetist part of it?
So, a certified registered nurse anesthetist um, is about as high as you can go in terms of education with a nursing degree. There's nurse practitioners, which can be a doctoral prepared program. But as far as specialization, it's about as high as you can go with a nursing degree. What caused me to jump into it was I wish I had a great story about it, but my wife talked me into it. She was an operating room nurse, still is an operating room nurse. And so she got to work alongside a lot of nurse anesthetists at the different hospitals that she worked in. And at the time, I was a critical care nurse. So I worked in intensive care units for a little while. And that experience is actually mandatory and required to be admitted into a program for nurse anesthetists. But yeah, I didn't really have much exposure to the operating room prior to this. Um, at this particular moment in time when I decided to do it, I knew they made a lot of money, which was very appealing to me. But I've always loved the sciences. This was heavily science based, the curriculum for it. And so, yeah, she talked me into it. I applied and things fell into place and it worked out.
And where did you get your education from?
So I'm originally from Houston, Texas. I did an undergraduate uh, work at Texas A&M University. At the time that I went there, they did not have very many healthcare programs. So after I kind of figured out what I wanted to do, I knew it was going to be probably in healthcare. I was considering orthodontics and dentistry, but I quickly changed gears. I then transferred my credits over to the University of Texas Medical Branch in Galveston, Texas. And this is a branch of the University of Texas that's only medical careers. So there's physical therapy, occupational therapy, speech therapy, physicians, uh, physician's assistants, and nursing. And I completed my nursing degree there. That was a bachelor's degree. Finished that in 1996. I then got out into the field and worked to pay off those student loans, eventually did. Uh, and then I jumped into something that's still out there today. It was called travel nursing. Um, with this, there was a nursing shortage back in the 90s. And so I took a job with a company that allowed me to fill positions for nursing all over the country. The assignments were about 13 weeks with an option to extend those out. They usually paid for your housing, gave you a stipend to live. And as a uh, mid 20 something year old, this was super fun, but it allowed me to become exposed to a lot of different ways to take care of patients and nursing, a lot of different fields in nursing. And then along the way, I again met my wife. She exposed me to the anesthesia side of it. And then I applied to a number of different schools. Um, and I eventually got into Texas Christian University, TCU, which is in Fort Worth, Texas. And that's where I began that. And that was from the years 2004 through 2006.
And you mentioned a couple things I want to touch on, like starting pay. So, what would you say, ballpark? I know you've been doing it for a while, but what would you
Mhm.
say starting pay for a registered nurse anesthetist today is?
So, a registered nurse anesthetist, the pay varies from region to region. In poor and underprivileged areas, you can make a lot of money because just not a lot of people want to practice there. The patients are typically a little more sick. And so you're going to work a little harder, but you'll make a little bit more. Starting pay coming out as a new graduate can probably be in the range of 150,000 a year, upwards of $180,000 a year. I have seen pay for people that are working it and really humping it. They've made $300,000 plus a year. They work their tails off. They really do. I've known a couple of them. But what's most appealing about this career, honestly, that I love about it is the flexibility and ability to have a family. So a lot of people think of anesthesia, the operating room is open 24/7. And there's people that need to work in that space. I have the flexibility where I have a family friendly job, as I do have some young children. Um, but the family friendliness of it, working in a day surgery center versus a hospital setting, is probably in my stage of life one of the most appealing things about this position.
Yeah, that I'm glad you talked about that because I was going to ask what benefit there is. But I also want to know what skills are needed. I mean, I think of when you're doing the anesthesia part, you're knocking a person out unconscious and bringing them back. So I don't know that I would feel comfortable doing that. What internally does it take to be able to do that and do it successfully and not have any regrets or fear or worry as you're doing it?
You know, it is spooky. And I have to remind myself, I am in surgery all day, almost every single day. And it's a part of my being. But um, most people only have one, two, maybe three surgeries in their lifetime. And so they're stepping into something that is very unknown. For privacy reasons, you can't really know a whole lot about what happens in an operating room. Um, Back in the day, YouTube didn't exist, but now there's more videos about it. But that might not always be a true picture of what happens in an operating room. Uh, I will tell you, speaking to your students, a love of the sciences has to be there. I took an anatomy and physiology class when I was in 10th grade that was really eye-opening for me. It helped really start, and this was about the age when was starting to think about what I wanted to do, figuring it out. which was very different than everybody else in my family who was heavily in education. They did a lot of, so all my brothers are teachers or educators or administrators, and my folks were as well. So jumping into healthcare, nobody in my family really knew it, but I really had a love of the sciences, and anatomy and physiology was just really interesting to me. And it takes an element of care and compassion when you are talking to people who are really vulnerable because they don't know really much about anesthesia or what it means to have a surgery, and it's very intimidating to people. So you really have to have the patience and time to stop and just talk and listen to them. Um, and I wasn't always good at that, but it over time I've gotten better on and and how to talk to people when they're a little spooked out about what we have to talk about.
So some interpersonal skills and relationship building.
Exactly.
What about decisiveness and judgment and feeling confident with what you're doing? Would you say those are skills necessary?
They are skills, but they you develop those over time. When if somebody's seeking this profession, there's a didactic, an in-class portion of it where you are just your head is crammed full of science and knowledge, and it's hard and it's difficult and it's super rewarding. And then there's the residency part of it when you're actually putting everything you learned into practice, and you build confidence through that process. A really good mentor is pretty important during that, and I had one, and a lady named Dolores when I did my residency way back in the day, and she was just phenomenal. I still send her Christmas cards every single year, and that was 15 or so years ago. Um, so that's really important, but you'll develop confidence with what you do. It's important not to be taught to be cavalier versus confident in this facility. You can't be too afraid, or in this specialty, you can't be too afraid to call for help or know what your limits are. It's just, good decision making, critical thinking is always really important, and crisis management. The best way to handle a crisis in the operating room is not to get into one at all. So being really diligent in your decision making leading up to getting somebody off to sleep.
Would you say, just for, again, the youth watching this, that you did have some fear, anxiety when you first started, and over your tenure, you've gotten more confident?
You know, I still remember my very first clinical day. And so an operating room day in a hospital system usually kicks off about 7:30. First case is usually 7:30. Scheduled case is at 7:30. And I remember with the other residents I was paired with, us figuring out how soon we wanted to get to the hospital to get prepared for our very first case. And I think I showed up at like 4:30 in the morning. And myself and a buddy, we got there super early so that we can be completely prepared. It's no fun to be unprepared when something is of this important, this amount of importance to a patient. So it was really spooky. It took a lot of time. I made a few mistakes, but they weren't thankfully, super costly mistakes, and I got chewed out a little bit for when I didn't show up prepared, because there's a lot of cases that you can be thrown on in an emergency situation. But yeah, you take your licks and you keep on going. I learned more from my mistakes than I ever did any successes I had.
Isn't that always the case?
It is. It really is.
So you started having an interest when you were in that anatomy and physiology class. As you're looking at kids watching this who are interested in that nursing or healthcare profession, what other high school classes should they consider?
There's with every college level program, there's going to be some prerequisites, and every part of the classes that are not sciences is important. I have to do math calculation, and I hate math. I literally hate math. I can't stand it. I'm not terribly good at it, but I have math calculations with every single case. Most every anesthetic medication used today is based on how much a patient weighs, and figuring out how those all work together is really important. So all the classes are important. Um, your English class. When I speak to these patients, I need to sound confident, and I don't want to sound like an idiot. And I want to convey to them I know what I'm talking about. And by speaking uh, fluently in not only the language of anesthesia, but in just common conversations, is going to inspire confidence. So they turn over all their trust to me to care for them when I get them off to sleep. There's a lot of sciences involved with anesthesia. A lot of not only how the body is made, but how the body works and how it responds to different medications. Um, and there's those medications have interactions with each other, and knowing those, not necessarily remembering them all, but also knowing where to go to find the information you need in order to perform the anesthetic that you need to do.
You sound like you really enjoy what you do and have a lot of passion for the patients and wanting to serve them well.
I I I love what I do. And I am somebody who has to be constantly stimulated through variety of what I do. Before I was at the position I'm at now, where I practice here in Minneapolis, I sought that variety out by practicing in different locations. I was in a position which is called a locums position, where I would work for a company and I filled different positions at different surgery centers or hospitals, and I might go to 5 different locations in any given day. And I sought um, that need for variety through different locations. Uh, Now where I work, it's at one physical location, but the variety of the procedures I do, my opportunities to expand my role, not only from an anesthesia provider, but management of a surgery center, and keeping you know the employees engaged, and continuing education, always staying up to date, because anesthesia has changed a lot since I first came out. But there's always these opportunities for advancement of your own personal knowledge. Yeah, those things keep me engaged and interested in this field. And I think it's important to distinguish between a job and a career. A job, there's jobs everywhere, and people have jobs, and jobs are important. And then there's a career, and the career is just is something you've chosen as a passion for you. Uh, that's what I've chosen as anesthesia for myself. Sorry, phone call. Um, that's what I've chosen for myself as a career. I've had plenty of jobs in my lifetime, and I treated them like jobs. But now I treat this one like a career. It's super important to me.
And what would be the difference between a job and a career for kids that are maybe just looking at careers and what they want to do? What would you say is the big difference to define that role of a job versus career?
I think when you're thinking of a career, you have to think the long game. What are you looking to do that's going to bring you happiness from a professional standpoint? Um, I try not to let this job define me. I do love it. It's not a bad thing if it defines me, because I love it that much. But I worked many jobs as stepping stones to get to the career that I wanted. And I learned something along the way each time. My very first job was when I was in high school. And as I said, my father and my parents, my father was an administrator for a school district, and this is in Houston. And my summer job was, I literally carried around a black can of paint and a paintbrush in the school bus yard, and I had to repaint the school bus bumpers in 90 plus degrees on black pavement with jeans as a dress code. And and it was grueling. I don't know why father put me into that job, but he did. But it taught me a lot of lessons, and it's a big badge of honor that I roughed it. But even, just opportunities to talk to other people. As a high school student, you're still developing your interpersonal communication.
Mhm.
But so it was forced me into a situation where I had to talk to other people by that very first job and get to know different, lifestyles and circumstances of other people. Even that, there's lessons learned, even those at that job, and that was, geez, 30 years ago, 40 years ago. Oh no. Yeah, something along that line.
Sorry, didn't mean to age you. But thank you so much for your time today, Chad. This was enticing, interesting, and the kids are really going to appreciate what you've been able to share today.
Oh, I'm glad. I hope there's a couple of nuggets of wisdom. I want to encourage them to stick with your education. It will never be taken away from you, no matter what life throws at you. If you get your education, you can do anything. You can always build upon it. You will never regret getting smarter.
All right. Thank you so much.
Thanks a lot, Jamie.